Alright, so we are actually talking about some factors that will basically solidify our knowledge again as we look into acute renal failure. Okay, so what we are looking at now is the RAAS system. Now the RAAS is what we call the Renin-Angiotensin-Aldosterone System. Okay, Renin-Angiotensin-Aldosterone System. Now you can see that from angiotensinogen it becomes angiotensin I. From angiotensin I it becomes angiotensin II. Okay, and that's what basically acts to like control fluid in and fluid, how fluid will be put out from the body. Okay, so what we said that the RAAS system is actually a very important hormone cascade. So it's a vital hormone cascade. Okay, and you could see pictorial representation of the cascade. So it's actually what helps to control your blood pressure, control your fluid balance, control the levels of electrolytes in your body. So it's like your body's internal plumbing and pressure control system. Okay, especially important when you are dehydrated, when you are bleeding, or you are facing an issue of low blood pressure. Do you understand? So this one is very, very important when resources are going down. When resources are okay or going up, you barely have the system. All right, you not really feel the importance of the system. Do you understand? It's still when you have to now manage resources. So I'm basically trying to talk about the components of this system. The first one is renin. Now you should know that renin is a stuff that is actually being released by an enzyme released by the kidneys. All right, and it's released mostly when your blood pressures is going down, when your sodium levels in the body is going down, when your sympathetic nervous system is being stimulated too much. Sympathetic nervous system, that's like the system for fight, fright, and flight. Okay, so if you have all those things being stimulated, the kidneys will release renin. Angiotensinogen is an inactive precursor produced by the liver. So angiotensin I, so it forms when this renin released from the kidney will now meet the angiotensinogen. Can you see how two far organs are basically communicating? Then angiotensin will actually from angiotensin I to angiotensin II, which is the one that is very nice and can be able to act. Okay, then aldosterone is a hormone from the adrenal cortex, promotes sodium and water retention and also potassium excretion. Okay, so how the RAAS system works. So things that usually triggers the RAAS system is low blood pressure, low sodium levels, sympathetic nervous system. So if any of these is switched on, the RAAS system is also switched on. All right, so the main step that is the most important step here is when renin acts on angiotensinogen to convert it to angiotensin I. Then angiotensin I is converted to angiotensin II by the angiotensin converting enzyme. Okay, so effects of this angiotensin II now, it will cause blood vessels to become vasoconstricted. Okay, then also triggers antidiuretic hormone release. Okay, so that's what actually enhances water reabsorption. Okay, then increases taste. All right, so it will make it that the person will actually want to take water. Okay, all right. So aldosterone action, so it acts on the distal nephrons in the kidneys, increases sodium reabsorption and potassium excretion. So everything we want to now, what leads to what? Water retention. All right. So the blood volume that was on the low side, this will now trigger it to basically go up again. So clinical importance, we say that overactivation of the RAAS can contribute to what? Too much blood volume being stacked up in the body, so the person's blood pressure is on the high side. Okay, it could also lead to heart failure, it could lead to chronic kidney disease. So medications targeting RAAS, that's, you can have some medications trying to target this system so that it can inhibit it. So angiotensin-converting enzyme inhibitors, of course this should act on the angiotensin-converting enzyme, okay, so that it will not be able to convert angiotensin I to angiotensin II. Okay, then angiotensin receptor blockers, those ones basically, you have the receptor, so that even if you have the angiotensin in the system, it will not be able to act on it. Okay, then aldosterone antagonist, those ones, when you see something is antagonistic, it's against the action of something. All right, so we'll talk about them when we're talking about the diuretics. That's how they call them. That's it for the overview of the RAAS system.